Health Novo presents Sushruta, our health awareness channel.
Hi moms, and we are back. After spending a little time discussing all the problems from newborns to 1-year-olds, we're going to shift our attention now to common issues that 2-year-olds, 1.5-year-olds face. The first issue that we're going to talk about is a very sensitive issue, an issue of bedwetting. Bedwetting is something that affects the child, affects its family. It changes the mental status of the child, and if not taken care of or approached in the right manner, can really trouble the child on long-term basis. Hi, I'm Dr. Nihar Parekh, and with me is Dr. Pankaj Parekh, and today we're going to hop on to another journey.
Bedwetting is a problem which troubles the full family. The parents are anxious because they are worried about child. And the child is nervous because he cannot go for a picnic. He cannot go to relatives and friends' house to stay overnight. Bedwetting basically means any child who wets the bed in sleep, may it be at night or even in the afternoon when the baby or a child goes to sleep. We consider it abnormal if it continues to happen after 5 years of age. Till 5 years, you should not worry about it. After 5 years of age, when the children have bedwetting, in medical we call it as a nocturnal enuresis. There are two types. One is a primary and one is secondary. I will tell you something about primary. Primary means the baby never achieved a control over urination during sleep. That means the baby was never normal, has been wetting the bed ever since he was born. Up to 5 years, we find after 5 years it is abnormal. The primary enuresis has many causes. The most important cause is a familial. We call it as a genetics. Now familial means there is always an history where a father, mother or somebody in a family had the same history and used to wet the bed when they were young. Number two cause is some structural defect. Maybe in the urinary bladder, maybe in the kidney, or maybe in the spine. Some small mass in the spine or spina bifida we call, from where the nerves come which control urination are damaged or compressed, and that's why the bedwetting can occur. There is a hormone known as antidiuretic hormone. In short, we call it as ADH. In a normal child, ADH level increases at night, thereby reducing the urine production and preventing bedwetting. There are many children where the ADH level at night does not increase, and that's why relatively there is a more urine production in the night and child wets the bed. There are some children who are very deep sleeper. They are so much in the deep sleep they don't even get a sensation of passing urine, and that's why they wet the bed. There's one more thing is the bladder's capacity is small and there is not proper coordination between the bladder muscles and the sphincter, and that's why they pass urine in the bed. And these are a few common causes. I'll request Dr. Nihar to explain you about the secondary bedwetting.
Thank you, sir. So as Dr. Parekh explained, the primary causes of nocturnal enuresis, I'm going to talk about the causes of secondary nocturnal enuresis. Means the child never used to wet his bed before, had a period of 6 months of no bedwetting, but has suddenly started wetting the bed again in the night. This is secondary nocturnal enuresis. The causes of secondary nocturnal enuresis, the most important job that we have to do at that time is to rule out an underlying urinary tract infection, which is one of the commonest causes of secondary nocturnal enuresis. Second is children with chronic constipation. They're straining at stool all day long, over a period of time, takes a toll over the muscles of the sphincter, loosens them, and then they start wetting the bed. Third, and the second most common cause of secondary nocturnal enuresis are all behavioral issues. Stress of exams, stress at school, changes of environment in the form of change of school, change of residence, losing a very close family member, putting stress on the child. These are commonest causes in which the children start wetting the bed again. And sometimes, very rarely, it's related to behavioral disorders like ADHD, that is the attention deficit hyperactive disorder. So these are causes of bedwetting. This is what nocturnal enuresis is all about. It is a true test of patience of the child, of the parents. So I think we should always get the right knowledge and the right help at the right time. One of the rare causes, but a cause that we cannot afford to miss, of secondary nocturnal enuresis is diabetes in children. This is how it is picked up for the first time. So it is a must not to take it lightly at whatever age it is. Secondary nocturnal enuresis, you have to meet the doctor.